movement-supported automatic telehealth machine for public health at Poltekkes Kemenkes Palu. Okay, the time is 10 minutes. So please, you can start from now.
Okay, hello. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, everyone. Thank you for the opportunity given to me to present our study. Yeah, let me share our PowerPoint. Okay. I would like to present our study about implementation of healthy living community movement supported automatic telehealth machine for public health at Poltekkes, Kemenkes, Palu. So Indonesia faced a serious challenge from a double burden disease caused by change in people lifestyle since 2010, and CDS such as hypertension, stroke, and heart disease have had a larger proportion in health services. The outbreak of coronavirus disease 2019 by the novel coronavirus, leading worldwide healthcare problem for comorbidities, patient routine health with COVID-19 had higher numbers of hypertension, diabetes, and cardiovascular disease can be implemented in for health checking and education. So that's the summary of our study. So BERMAS is systematic and planned action carried out jointly by all components of the nation with awareness, willingness, and ability to behave in healthy manner to improve our quality life. The outbreak of coronavirus disease 2019 by the novel coronavirus is the leading worldwide healthcare problem for comorbidities. Patients with COVID-19 had higher numbers of hypertension, diabetes, and other cardiovascular disease that need routine health monitoring. So telehealth in nursing can be developed for use in the field of education and nursing services. So the telehealth program can be a milestone for the implementation of the Internet of Things in the health sector for the public and can be applied in Indonesia. So we make automatic telehealth machine for public health or ATM telehealth. It is Internet of Things for long distance health services in public area. This device provides several telehealth features like health checking and education. Health checking that can be measured blood pressure, blood sugar level and cholesterol, weight, temperature, and blood oxygen level. So the health check result will be stored in an app that can be opened in a smartphone. The education feature will help the community to get information about non-communicable disease and prevention of complication. ATM's Health has registered a patent with in Kemenkes. We our participation in 2019 Health Fire. So the aims of this study is to implement the Healthy Living Community Movement Program using automatic telehealth machine as Internet of Things for health checking and education at Poltekkes Kemenkes Palu. The method is quasi-experimental intervention research. We give intervention like fluid feeding, physical activity, then followed by measuring glucose level, cholesterol, and blood pressure using ATM cell. The research was conducted at Poltekkes Kemenkes Palu in Palu. The population of study were 167 employees, and the sampling using random sampling method with size consists of 96 people. So the result, the research conducted in 28 October until 6 December 2020 in Poltekkes Kemenkes Palu. The respondents have performed regular health checks, stretch at 10 p.m. and 2 p.m. and consume fruits. The result of this study, the study revealed that majority of respondents were female and age from 40 until 65 years. Physical activity was generally good and fluid intake was also good. Systole of 11.5% of respondents greater than or equal to 140 mmHg the blood pressure, and the diastole 20%, 25% of the respondents have greater than or equal to 90 mmHg, and the glucose there is 6.3% greater than or equal 200 mg per dl, and cholesterol there is 76% of the respondents have greater than or equal to 200 mg per dl. Next, the variable that were significantly related to systole were gender and age category. In this study, men had higher systolic blood pressure than women, and those age 40 to 65 years had higher systolic blood pressure than those age 25 to 39 years old. The variable which were significantly related to diastole were gender and age category. In the study, men had higher diastolic blood pressure than women. And the last, and next, the glucose. The result revealed that gender, age, physical activity, and food intake was not associated with blood glucose level, as well as the cholesterol too. There is no associated or significant relations about the gender, age, physical activity, and food intake with the cholesterol level. So, majority of respondents were female, however, and age 40 to 65 years. Generally good for physical activity and food intake. However, the study result revealed that there is 11.5% respondent had systole greater than or equal to 140 mmHg. Especially for cholesterol, there is 76% had total cholesterol greater than or equal to 200 mg per dl. So the variable that we are significantly related to systole is gender and age category. Men are more likely to have higher systolic and diastolic blood pressure than women.
I'm sorry.
So the result.
Yes, sir.
Yes.
2-minute lapse.
2-minute lapse. Okay. The result of this study showed a positive result with the prevalence of hypertension in general. There is in Indonesia there is 33.4% females than males. So, but the result is similar with study in Korean that designed to investigate factor associated with hypertension, where hypertension was higher in men than in women. However, after the age of 60 years, hypertension was more prevalent in females than in males. So there is 76% respondent have total cholesterol greater than or equal to 200 mg per dl. So this is the symptom of dyslipidemia. So dyslipidemia is one of the leading role risk factor for hypertension disease, and the most target organ damage was found related to hypertension are heart disease. So the relationship of dyslipidemia with the incidence of coronary heart disease differ according to hypertension status. Hypertension respondent, those with dyslipidemia was 18.1 times more likely to develop GHD compared with those non-dyslipidemia. And respondent have programmed regular health check and stretch and consume the fruit, but and respondent get fraction of health checking in app and information about non-communicable disease. Two, this same with the program. We 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 in 2016 and 2017, the Ministry of Health of the Indonesian Republic focused to three activities of health living community movement. So this is same with this program. In England, some program for risk management, for cardiovascular risk management, do these things too to evaluate the health, to measure the blood pressure of the people at this during 6 years follow-up. So the risk factor values showed no tradition to 6 years following is health check in BMI, blood pressure, and smoking, which may be of public health importance. Next is person study using a ATM Sehat using telehealth system. Other study that focus to telemedicine potential for changing behaviors. Yeah, the point is other study that suggested of using of telehealth or telehealth system or telemedicine system for control the disease, the hypertension disease. So the conclusion is automated telehealth machine can be implemented for health checking and education in health living community movement programs. And we suggest that the implementation of health ATM Sehat in the health living community movement at Poltekkes, Kemenkes Palu could expanded its scope and benefits and increase the participation. And yeah, there should be with the next we will make research will be continued by developing the design and other variables such as chance in responding behavior and specific. Thank you very much for the opportunity and time. Back to the master of the.
Okay, thank you very much for Mr. Junaidi. Now it's time question and answering session. For the session is 10 minutes. So who want to ask? So please langsung saja bertanya kepada Mr. Junaidi. Is there any question?
Tanya aja.
Yeah, please.
I'm sorry, Miss. I'm sorry, moderator. Can I give the questions?
Yes, please.
Yes, please.
Okay, actually, this research is new for me, and then I don't know a lot about this research, so I'm curious about this machine. Is that the telehealth the ATM machine is just focused on the blood glucose, or it can identify many signs and symptoms.
Okay, thank you.
Yeah.
Yeah.
It is clear. Is it clear?
Yes, yes, yes.
Yeah. Okay. Thank you.
Yeah, welcome. To answer the question, so ATM Sehat is the innovation from Poltekkes Kemenkes Palu. We developed some Internet of Things. We connect the biosensor from like a blood pressure, 10C in Indonesia, and blood sugar level or glucose, and cholesterol meter, glucose and cholesterol meter, as well as weight sensor and temperature too, and blood oxygen level. So all these biosensor connected to the ATM Sehat, and all of the result will send to your app in smartphone. So you should to download this app in the Google app. So after that, all the result will be set safely in this app, and inside the app you will get the education and information about the disease, especially non-communicable disease, especially non-communicable disease. So like that, is it clear the answer, or do you have another answer? Another question, sorry.
Thank you for Mr. Junaidi for the answer. It's very, very extraordinary. So I hope this machine can be developed to the massive usage. So we can not just the Poltekkes Palu, not just Poltekkes Palu that can use it. So good job. Thank you,
Yes,
Mr.
yes,
Junaidi.
yes, sure. Thank you. Welcome.
Okay.
Perhaps we will mass produce this device, and future research and development still need to make this device more have advanced and benefit for people. Thank you.
Thank you, Mr. Junaidi.
Okay, thank you very much. Is there any question from the other people? No? Okay. So next we're going to reviewer. The reviewer is for Mr. Randy. Excuse me, Mr. Randy.
Okay.
Okay, time is yours.
We can hear you. Okay, it is new information for me, and I think it's very useful to increase health status in Indonesia. Okay, how many money you must pay to make it, Mrs. Junaidi? It is very expensive.
Oh, yes. Yes, okay. It's about the cost to produce our innovation, right?
Yep.
Mr. Randy?
Yeah.
The cost?
Cost.
Yeah, okay. Yes, okay. So the cost to make this device quite expensive actually. 30, 30, 30 and so million rupees we
Oh.
should to invest. But there's that's why I told to the first patient, yeah, we will develop the device. So in my mind, we will develop this device more portable, like some case, some office case, something like that. So the cost to make the device will be reduced because most of the cost uh, to make this device should should to uh, should to make the casing. The
Oh,
casing. So the casing is quite expensive, to make some ATM physically like that. The cost is quite expensive. Yeah, I think it's possible and feasible
no.
to make the portable device. However, if we check for the biosensor cost, it's not too expensive.
Yeah.
Yeah, the casing is expensive,
Okay.
the monitoring other.
I ever get information from Dr. Jajang, staff our Menteri, and in Jakarta, they say Kemenkes have application to service um, Indonesian with telehealth. What is the different telehealth and ATM? Telehealth based on internet, and ATM Indonesian must or people must come to the ATM or can access with using internet or
Okay, I see. So actually, Kemenkes, Minister of Health, already have the application, the name of the application, if I'm not mistaken, is Healthpedia. Say Healthpedia, if I'm not mistaken. So you can do a teleconsultation through your smartphone. You can ask the patient to the doctors, and the doctor will reply your patient and give information about your condition. Uh, the the difference of that system with our system is we have IoT, Internet of Things devices. So not only do teleconsultation, but you can do telechecking or checking your health condition like blood pressure, glucose,
oh,
cholesterol, weight, and others. After you do the health checking, you can send the result of the health checking to the doctor through the app. So we use app too, like Minister of Health, Healthpedia uh, already have, but uh, again we have. I would like to say big data or health data. So we have health data or big data to help doctor or nurses uh, to make some conclusion about the health condition of the people or the user. I mean, so it will be good for nurses or doctors to how to say it to strengthen their trust what is actually the condition of the patient, not only based from interview like symptom, but also uh, there is but also there is uh, health data. I mean, there is a blood pressure result and etc. Actually, not only this, we can develop these devices with another biosensor like EKG and other devices, other biosensor, something like that. Yes. So I like that, Mr. Ren.
Okay, it's very complicated and very useful to other people. Okay, good,
Yes, thank you.
Mr. Junaidi. I think that's all, uh, moderator.
Okay, thank you for everyone. Thank you for Mr. Randy for the review, and thank you for Mr. Junaidi for the interesting and extraordinary information. Now,
Welcome.
yeah, ladies and gentlemen, now we finally come to the end part of this presentation. Before I close the presentation, I'd like to thank so much to the all speaker for informative and interesting presentation, and also to the participant who very active participation. Hopefully, the program will beneficially for everyone. And please give a applause for you all. Thank you. Last time I asked for your forgiveness because of my mistakes, and wassalamualaikum warahmatullahi wabarakatuh. For additional
Waalaikumsalam warahmatullahi
information,
wabarakatuh.
if you are not yet to filling the link registration for a certificate, you can fill in as soon as possible. The link is in the participant group. Once again, who have for all the participants who have not filled the certificate link, you can fill in as soon as possible. The link is in the participant group, in our group entitled oral presentation. And the last, I want to take a screenshot of our room. So for all the participants, can you just on your camera, please? For Mrs. Sani, Mrs. Sumiati, Mrs. Sri Lestari, can you just turn on your camera because I would like to take a screenshot. Okay. Give your best smile even, although it is hide by your mask. 1, 2, 3. Once again, 1, 2, 3. Thank you for everyone. Good afternoon
Thank
and
you.
good job for today. Baik, untuk seluruh peserta atau partisipan bisa langsung live dari room. Untuk informasi tambahan nanti akan disampaikan di grup oral presentation oleh Bapak Randy. Sekali lagi, untuk informasi tambahan lain-lain nanti akan disampaikan oleh Bapak Randy di grup oral presentation. Terima kasih.
Permisi,
Selamat
Mbak.
sore. Iya.
Oh iya, baik. Oke. Oh ya, boleh tanya nggak Mbak? Bisa nggak saya dapat recordingnya yang tadi dimintain sebagai bukti di Poltekkes? Saya lupa untuk recording. Bisa nggak? Halo.
Ya, untuk recording ada, nanti
Iya.
bisa dikirimkan. Oke, ada yang lain? Cukup ya? Baik, terima kasih untuk seluruh partisipan hari ini. Sampai jumpa di kesempatan berikutnya.